Do you support Donald Trump?
So I do,
Okay,
and
if
I
you could go
think
back in
that
time and you could either vote for Donald Trump or Kamala Harris, who would you rather vote for?
no, I would vote for Trump, and I'll tell you why. Right?
Go ahead.
I think that his actions that he took with setting out the National Guard is not the worst idea. I think it's okay, right?
So he's violated the law with the National Guard on multiple occasions, not only in the context of California, but also violated the law specifically in wanting to drop it in Portland and
Yeah, but
in
sometimes,
Chicago.
brother,
If he specifically wants to drop the National Guard in places with high rates and high violent crime rates, how about he starts with red states so that he can prove that it's effective to the rest of the nation, and then he can
well,
move to
you
the
have
rest of
to.
the nation with their
Okay,
consent, because you
I
have to have the
see.
consent of the governor.
No, I see what you're saying, and I don't disagree with you. But what I'm saying is, it has to start somewhere, and it starts here with the blue states.
No,
It'll
that
go
makes
to
no
the red
sense.
states. What do you mean? Doesn't make any sense?
I just told you it makes no sense to go through blue states because it's not constitutionally allowed, because they will not allow for you to do that because you have to have the consent of the governor.
Bro, constitutionally allowed doesn't matter anymore. It doesn't matter. It
Why?
doesn't. Let's be honest. Why? Because you can do whatever you want, and it just gets pushed through. And then you know what? You have to wait like 8 months for a Supreme Court case to go through. That's why.
So you have no issue with Trump violating the law.
No, because you know why?
You have no issue with him violating the Constitution and the law. Wow, that's
I have
actually
bigger issue
unhinged.
with those laws not being in place to start with, right?
Okay,
So
so then let's talk about this. Do you think undocumented immigrants coming to the country, if they haven't committed a violent crime or bad crime, should be punished and deported?
for the benefit that they give to our economy, no, I don't think so.
Okay, well then you
I see.
disagree with Donald Trump's mass deportation policy, it seems.
I look. I see it both ways, man. All right. First of all, there's people who are getting jobs based on that. What's happening, right? Is that fair to say?
They're getting jobs based on what? Sorry, what do you mean? Like, you mean removing
Based
people
on
from
those
coming to the
people
country?
now. Yeah, exactly.
So because ICE agents are getting jobs, you support it? What? Could you get jobs in renewable energy
No, not,
production,
no,
which
no,
Donald
no,
Trump
no,
is
no,
gutting
no,
because
no,
he cut rid of the subsidies and the funding for renewable energy
no,
production?
not
Couldn't
ice
we
agents.
provide more jobs in making the legal immigration system go quicker by providing more immigration judges?
No, I didn't say ice agents. Okay.
Okay, sorry.
Right. Like the jobs that the people that they deported, right? Those jobs.
Oh, I actually think that it reduces the level of jobs within our economy because it reduces the level of demand within our economy. Because when people are coming to our country, they're not only fulfilling a job, they're also
Yeah, but again,
demanding goods and services, meaning that they increase the amount of jobs that exist in our economy because they have to meet a different level of supply.
it gets taxpayers into those jobs, right?
What'd you say?
It gets taxpayers into those jobs, like
Undocumented
people who actually
immigrants
pay
pay
taxes.
taxes. So undocumented immigrants have paid $100
No, they
billion in
pay
taxes in
sales taxes,
2022.
bro. Don't try this on me, dude. Dude, they pay sales taxes. That's it.
Not
Okay.
just sales. They can have ITINs and they can pay different aspects of income tax as well.
Okay. They have. Okay. If you say so, okay, sure. Okay. But overall, they don't contribute much to the tax system, right? They also don't get. Actually, they actually derive a lot out of the tax system.
No,
You know
no.
how? You want to know how?
Are you gonna say like emergency
Yeah, I'm
healthcare?
gonna tell you. No, yeah, that's exactly where I was going.
Yeah, everyone gets emergency healthcare, even tourists. If a tourist can't
Yeah,
pay for their healthcare, should we let them in the ER,
no,
or would we
absolutely
take care
not.
of them?
No, no, we should take care of
You're
them.
not gonna ask for their immigration status or their ability to pay when they're on the table. You're gonna save their life,
Well,
right?
no, they don't always go to the ER under those circumstances, Peter Parker.
Okay, I'm not saying that people always do, but I'm just saying in those circumstances, that's specifically where it's covered.
Yeah, but maybe you don't know this, but you can just go to the ER for whatever reason, right? It does not need to be an actual emergency, right? Are you
Then they
aware?
wouldn't be able to get it.
Dude, what do you? All right, you're very wrong on this
The
topic.
emergency
Okay.
healthcare is an emergency circumstance. It's not just like they can go to the ER for anything.
No, dude, you can just go there. All you have to do is not show social security, and then you get whatever service that you want. Like, right? Not like obviously not if you have cancer or something like that, but like they will treat you for whatever you come in there. That's not a long-term health issue, right?
Okay. So yeah, one, I think that you should be treated, right? And two is related to this. You think that like undocumented immigrants would risk being deported by going to the
No, I'm saying
get
it's a
ER?
larger impact on the health system than you are letting on to be.
No, no, I acknowledge
Okay.
that it's an impact, but I think it's important and it's necessary. These are rights. These are human rights.
No, I agree with you,
And just because they came to the
I
country
also,
undocumented does not give anyone a right to violate their human rights.
yeah, but Parker, I only disagree because it's not used in the way that you're suggesting. It's not.
It is. It genuinely is.
No,
You
it's
can ask
not.
doctors. You
No,
can talk to
it's
doctors. Talk to a doctor. I'm serious. Talk to
dude.
doctors that work in
Where
the
do you
ER,
think I'm getting
in
this
the
opinion
ICU.
from? You think I wasn't talking to a doctor? You didn't think I got this idea
Probably.
from a doctor?
Probably because if you did talk to doctors, you would see that they have to do this and it's necessary to save people's lives, right? And that people aren't just coming in undocumented
No, I agree,
just for like
but the
anything.
doctors are the ones. They're the ones who said that it's being abused. The system is being abused.
And if we're
Okay,
not checking for immigration status, how do you know when they're undocumented?
dude. Like you know how like you can tell somebody is guilty and you don't
Oh,
actually have to go through the whole court case.
well, wait. Now, how do you identify that someone's undocumented just by looking at them?
No, dude. Yeah, I mean, like you just. I'll give you some ways, right? By not giving social security, by not speaking English, right? Those are certain ways that
Okay,
you can
not
tell.
speaking English and not providing your social security number is consistent with someone still living in the United States illegally.
No, I know. It's just. You ask, how can you
To me,
tell
it sounds like
if
you're
it's
racially
illegal?
profiling, and you're saying because they don't speak
No,
English that
dude,
they're in
I'm
the
not,
country
dude.
undocumented.
Dude, first of all, I didn't get this idea from nowhere, right? These are the doctors who are telling me this, okay?
Okay, so
Right?
doctors can't identify that someone's undocumented just by looking at them.
No, they can't on a theoretical way that you're trying to argue. Sure. No, they can't. But you have a pretty good idea given those two options that I just stated, okay? And it's not racially profiling. It's just, dude, it's just
That
a
was
fact of
you
the matter.
profiling. Like, I'm sorry, you just said that because they didn't speak English.
No, I said two things, right? I said no social security and
Yeah,
not speaking English.
yeah.
I
I'm
said two
sorry.
things.
I mean, for a huge portion of my life, I didn't know my social security number.
Well, that's
I was a child.
well,
I'm sorry. Like, and also there are plenty of other people out there that don't know their social security number off the top of their head.
okay, but the people who show up in the ER purposely do not
Yeah,
state
yeah.
those
Do you
things.
think everyone goes to the ER with their social security on them? No. There are lots of people that have social security numbers that don't go with
No,
their
because
social security number,
they
don't
don't
remember
have
their
one,
social
dude.
security number.
They don't have one. They don't have one. That's why.
So you say it's specifically that they don't have one. How would you be able to identify that just if they do not provide one?
Because 5% of the population who shows up in the ER probably is smart enough to understand to not give it so you don't get charged. The other 95% who shows up in the ER is because they know that you don't like they don't have one, and then they just you can get free treatment,
So no, you
right?
can't identify this. You're just coming up with an assumption.
Yeah, it's a pretty fair assumption, though.
A fair assumption based on just them speaking a different language. I mean, there's no official
No,
language
dude,
in the
dude
United States, and there are
your
lots of people that
assumption is
don't speak English that are
Parker,
U.S. citizens.
your assumption is equally as wrong as mine is. Okay,
No, it's
probably
not.
more so.
I'm not making an assumption. M- I would actually assume, if we're going to assume anything, that they are a citizen because it's actually most likely that they are.
That's not true, dude.
It is.
I
It
don't
is
know
most
what
likely that they are. Like, if someone goes into the ER, it's most likely that
based
they're a
on what
citizen.
facts. What facts are you basing this on,
Most
dude?
people who are taken care of in the ER are citizens. Do you
Okay,
dispute that? Do you dispute that fact?
no, I don't. I
Okay, thank
think
you.
that you're saying is true.
So then my assumption being that they're most likely a citizen makes sense, right?
No, but you're also neglecting the fact that a high percentage of illegal immigrants go into the ER and they don't have like like they don't have any way to prove that they're a citizen, and they go there for free healthcare.
So again, right? You think that undocumented immigrants are just coming to the country and like living off the government, not doing anything. That's like your thought, man.
No,
Undocumented
I
immigrants
think
would not risk being deported by
no.
going into a public space such as that specifically, where they wouldn't have the particular things that they need in order to identify themselves, right? Without it being an emergency. Okay, they are going to the emergency room in emergencies. Okay, oftentimes not out of their own intention, because it is the case that they were brought there
No,
because they
Parker,
were
Parker,
harmed.
Parker, that's where I disagree with you because they don't. They use it as general Medicare, like that. Like they just show up at the hospital if they have any sickness, any issues whatsoever. You don't provide your social security number, and then you don't have to pay anything. That's what they do, dude. It's like
It would be
it's
way too much.
not.
It'd be way too much of a risk for them to not for basic
It's not
things
a
that they
risk.
would need.
What is a
Yes, it
risk?
is.
What is a risk? You're not going to get
The,
arrested by police.
wait, I'm sorry. The risk specifically in not being able to identify themselves. I'm sorry. That's definitely the like an important thing to take into
Dude,
account.
you've never been to the ER if you think this way, dude.
What do you mean? I've never been to the ER. That is the dumbest shit that's ever came out of your mouth ever.
No,
Of course, I've been to
it's
the ER. What are
okay,
you talking
but
about, dude?
you provided your social security number. This is what you did, right? When you went there,
On the
right? So that
document, yes. But if I didn't remember it, then I wouldn't have.
no, but there's another way that you could go about this, which is
Bro,
not
I'm pretty
giving.
sure in the past that I have not put my social security number on that document.
Then you didn't get charged for it, right?
What do you mean? I would have. They still bill me.
No, they would not bill you if they don't have your social security. They don't know how to find you, dude. This is how it works.
No, you can still put in other information, right? It's not just social security, right?
No, I think it mainly is.
What?
I think it
Dude,
mainly
have you
is.
been to the ER? Have you been to the ER, bro?
Yeah,
Now I'm
I have.
asking you the question,
I
dude.
got stitches, bro. I got stitches. Yes, I've been there.
Okay. Well,
And you know what I did? I gave oh no, I know this is going down. And I gave them my real social security number, and I paid for that bill entirely.
okay. Good for you, man.
Probably not. But if I chose not to give them my social security, and I chose not to foot the bill, it would have been okay. And
Okay,
that's
then why
something
why
that
don't you do that then? Why doesn't everyone do that?
there's some people might have, right?
So you're saying healthcare could be free in this country? All you have to do is just not give them your social
No,
security
only ER.
number?
Oh, no, not all healthcare, just ER. Only ER healthcare.
Okay, so you could just go. So everyone can just go to the ER for free.
Yes, just don't give your social. Well, I'm not advocating this, right? Because this is not how nobody should do this. But if they were to do this, right, you know, don't give your social security, and then you
You know
don't
what?
have
How about you
to.
go try that out, bro?
I, who knows? Maybe I have. You know, maybe that's why I know about this. You know, possibly.
Did you just admit to committing fraud?
No, and I knew we were going there with this, which is why I didn't say I did. I just said I could have,
So you're saying
right?
you're saying you could have committed fraud?
I could have committed fraud that people do every day.
So you
That
could have
is
you
more often.
okay, so
No,
did you
stop
or did
changing
you
the
not
topic.
commit
No, no,
fraud?
no.
Because I
Parker,
can say
stop
I did
changing.
not commit fraud.
Okay. Parker, stop changing the topic because the point remains right. It's a pathway that people could do. Okay, and it's a pathway that people do a lot. Right. Okay, is that fair?
No, I don't think we're going anywhere with this conversation at this point. And Jenny, I'll try to wrap this back into the broader topic. Your point was that you think that we shouldn't be providing emergency health care for undocumented immigrants.
No, I think we should. I think that they are a burden on the system.
Okay.
That's
So
all.
then what was the original reason why you brought this up? It was because you were trying to justify why the government's currently shut down?
No.
Then what was the original point?
The original point was that immigrants have a burden on the system, and that's just all I was trying to point out.
Okay, so what's your point of this? You agreed that they should.
No, I agree that it should, like, we look. I don't know how to solve the problem. Okay, I don't know how to solve it. Right, but what I do know is that they are a burden on the healthcare system. That's it.
Very
Okay.
small portion. Very small portion. Secondly, right? You think they
Well, it
should. You
depends
think they
on.
should be able to get access to it.
Yeah, obviously, dude. I'm human.
Okay. People should have human rights. That's all you're saying. Okay. So then, given that that's the case, what's your point with this? Can we bring up like a point? How? Why do you like Trump's policy on immigration, for example?
Because he's reducing the burden on the healthcare system in a way.
Reducing the burden on the healthcare system. In what way?
Yeah, by the deportations.
So deporting people you think reduces the burden on the healthcare system, right? Then let's think of it this way. Would you want to reduce the amount of immigrants coming to our country legally?
Yeah,
Yeah.
yeah. I'd like
Do
them
you,
to
do you
do it
want to
legally.
reduce how many children we're having?
No, I see where you're going with this, dude.
Well, that would reduce the
And
burden on our
at a
healthcare
base
system, right?
level, at a base level, I agree with you on the concept of more people in general to produce more of an economy. I agree with you there. Okay,
Okay, so then
but I
so
just think
you
we're
disagree
not doing
with
it the right
reducing
way.
immigration and you disagree with it because of that reason. So
No, I
like
just think we're
it's
doing it the
not
wrong
because of
way.
the burden on the system. If you want to look at net burden, undocumented immigrants are not a net burden on our system. They net benefit our system.
Yeah, they do because they don't pay taxes, dude. I
They
understand that
do.
part.
They do.
No, they pay sales tax, dude. It's not.
Dude, we
It's
already
not
went
the
over this.
same.
It's more than sales. We already. Why are you, dude? I've already responded to this. Why'd you just say the same bull lie I've already responded to? That's
All
so
right, what
dishonest.
if it's not more than sales tax? What is it then? What else is it?
I already told you. Like through I-10s, they can specifically pay income.
I have no idea so if they start a business, then is that what you're talking about?
I'm saying
Because I
through
think
the.
is when they start a business, right?
Not
Or not?
necessarily.
Okay. Okay. So I guess I was wrong about that. All right. So okay. So what? I-10 they pay normal taxes like just all of us.
Yeah, they can. It's an individual tax identification number, and it literally is just used for them to pay a level of taxes. So, there are certain types of taxes that are paid. Do they pay to the same degree in terms of percentage? That's not the claim. But it's still the case that they are paying taxes into the system.
Generally
Now, if you want
speaking,
them to pay more taxes into the system, provide them a pathway to citizenship where they do not have to leave the country, and they will pay more into the system.
no, Parker. Look, generally I agree with you, but like most people do not have items. Okay, is that fair to say? Is that a fair statement?
Um, I would have to look at the data. I'm not quite sure on the percentage of people
I mean,
specifically
like
that do.
there's
I just know that
you
undocumented
know,
immigrants paid a lot in taxes, over $100 billion in 2022, for
yeah, they pay
example.
sales taxes. They don't, but the
I'm gonna go
item,
crazy.
bro. But the item fact that you stated, right? It's not it's not like the norm. It's not like a thing that happens very often. Okay, I know people with items. Okay, it's not very often. It's not like an often thing that happens. Okay, I don't know why you're just blankly staring at me, but
Because your point was just conjecture and bullshit, and you didn't actually respond to anything I said.
no,
You just
listen.
repeated the same bull talking point I already responded to. They're just paying sales tax.
No, Parker,
I
I
would
did
appreciate
respond
if you
to what you
actually
said.
engage with the points that I make. That'd be really appreciated.
I, dude, I am. I just engaged with the item part. What are you talking about,
No, you didn't. You just repeated the point that said that specifically they just pay sales tax.
bro? You don't even have the statistics to back up your point, okay? And I'm just
I
presenting
don't
the
need
other
to. I
stuff.
don't. What statistics did I need to back up the point that I made?
Yeah,
What statistic do I need to that I haven't provided about the point that I made?
the item, the whole item point, dude. Like
Do you want
you
me to
said
show you
that.
the statistic of $100 billion of taxes were paid in 2022 by undocumented
No, I
immigrants?
want you to prove that most people are under that system of tax
I
paying.
doesn't, dude. I don't have to know the percentage of people specifically in order to
I
know
know, but
that
it's
specifically
very
people are
low.
paying a lot to the system and that they're a net benefit to the system.
Parker,
We can
I'm
look at the
giving you
net
grace in
costs and we can
this.
look at the net benefits.
Parker, I'm giving you grace in this area. I understand that maybe there was not a high percentage of people in the I-10 category. Okay, I'm giving you grace in that area. Okay, I understand that. Okay, and you're going to search it up. Don't release the results because it's probably going to be in my favor. And let's just go with the assumption that it's, let's say, 50%. Okay, all right, fair. It's probably cool.
Um, yeah, I can't find any specific data on the particular percentage.
Yeah, it's probably a good thing. It's a good thing because that means that they can't be found by the U.S. government. So,
No, it just means that we can't identify what percent specifically of undocumented immigrants have I-10s.
okay.
Um, at least right off the bat, I have a new study claiming here that from the Institute on Taxation and Economic Policy that undocumented immigrants, specifically, wait, hold up, research suggests that 11 undocumented immigrants in the U.S. file income taxes with I-10s. Yeah, so that would be over 50%. So the ITEP report says the best evidence suggests that at least 50% of undocumented immigrants currently file income tax returns.
All right, and most of them are probably on green cards, right? They're
So
probably following the
you
law.
just said don't read it off because it will probably go in your benefit, and then it didn't.